Hello, good day to everyone watching, and thank you for the opportunity to present our research project, Printing Play into Practice, Gamified Learning with 3D Printed Teeth in Dental Education. Firstly, a short introduction to our research team, starting with myself. My name is Asma. I'm a recent graduate from dentistry at University College Cork in Ireland. I worked as a research assistant in this project along with Jose when we were in 4th and 3rd year of college respectively. And Dr. Andre Toulouse and Dr. Mutahir Alon, pictured here, also worked on this project, and they were the lead investigators from the Department of Anatomy and Neuroscience, also at University College Cork. So moving on. So in this presentation, I will go through the roadmap pictured here, and starting with what is tooth morphology. So teeth are unique to each individual, but they also have common characteristics which allow us to distinguish them from one another. For example, pictured here is an upper left central incisor with a rectangular shape and a sharp edge for cutting food. Next, a lower left canine used for tearing food apart. And then this is an upper left first premolar, also known as a bicuspid tooth due to the presence of two cusps seen here. And lastly, this is a lower first molar with 5 cusps and a flat biting surface used for grinding and chewing food. So what was the problem? Why did we go on and do this project? So dental professionals require a thorough knowledge of tooth morphology to identify teeth and in and outside of the mouth. So this is essential because they need to be familiar with tooth morphology, as it identifies, it helps in identifying teeth during examinations, recognizing anomalies, or diagnosing disease. It's also important for planning treatments and communicating with other dental professionals. It's also fundamental for providing preventative care, such as cleanings, since the shapes and grooves and contours of teeth influence how plaque and calculus accumulate on them. So replicating natural anatomy when creating restorations such as fillings impacts on the form and function and aesthetics of the prosthetic devices such as crowns and bridges that need to function correctly in the mouth as a result of their form. Finally, their unique morphological features can be used in forensic identification. So it is important for the identification of dental anomalies overall and in the dental profession. Dental morphology is taught during preclinical years of dental education, specifically Dental Hygiene 1 and dentistry students in 2nd year in UCC. Traditional methods of teaching, this include lectures, 2D images of teeth, and practical elements, for example, carving into soap, studying with plastic or resin models, and of course extracted teeth, which is the gold standard. Although these methods are widely used in dental schools, their limitations are increasingly being acknowledged. For example, lecture-based pedagogy continues to be used for establishing a foundation for students. However, it's constrained by a didactic methodology, which features lower student engagement and one-way communication. Hands-on methods like soap carving are excellent for building manual dexterity, but they have logistical issues, especially when designing standardized assessments for large groups of students. Plastic tooth models are easily accessible and widely used nowadays, but the downside is that their lack of anatomical variation makes them not as good elements for teaching. While extracted teeth are still considered the gold standard, they present a host of challenges, for example, ethical concerns in acquiring them, hygiene regulations in storing them, and increasing difficulty in sourcing well-preserved specimens of high quality that is suitable for teaching. particularly in quantities sufficient for large student cohorts. This is because patients are retaining teeth later into life, which are then more worn down or diseased and not suitable for teaching. So modern teaching methods incorporate elements such as online tests and quizzes, 3D simulations, dentistry applications, online videos, and flashcards. E-learning was found to be as effective as traditional learning methods, according to Lone et al. 2024. So this provides a greater capacity for an autonomous learning and allowing students to revisit material at their own pace. While these methods definitely engage today's generation of students, they also come with important drawbacks, as they rely heavily on self-motivation and require access to appropriate devices, which may not be readily available to all students, especially from marginalized groups. So what was our proposal? We evaluated how we teach dental morphology, and we recognized the limitations of both traditional and modern teaching methods and explored complementary strategies to better support today's students. To address these gaps, we integrated gamification with tactile 3D printed teeth as a supplement to conventional teaching approaches, challenging students with the goal of improving motivation, engagement, learning, and retention. This method helps relieve the pressure of relying on well-preserved extracted specimens by providing replicas of extracted teeth, which would have the real-life anatomical variations. It also encourages peer interaction through competition and peer learning, and fosters active participation. This approach met inclusive education aims aligned with the universal design for learning principles and supports diverse learning styles. So what did we do? This game was designed with students as co-creators and co-researchers. So myself and Jose were the co-researchers, whose prior experience with the tooth morphology module and understanding of student learning helped ensure that each challenge was appropriately calibrated. The game was developed as a supplementary tool to enhance teaching, as it integrated into the tooth morphology module, which is delivered to Year 1 dental hygiene and Year 2 dentistry students. So a total of 63 students were invited to participate, and 53 of them actively engaged at some point during the semester. The game was set up during the weekly 2-hour lab sessions, which ran over a 6-week period. Following the completion of the sessions, a post-study survey was conducted to gather participant feedback. So how were the 3D printed teeth created? To create them, adult teeth from the Department of Anatomy and Neuroscience were scanned, which were used then to generate digital models. These models were then used to print the replicas, which were then hand painted to increase their realism. And this was the end product. We then created a set of 60 cards with 20 cards for each difficulty level: beginner, intermediate, and advanced. So the beginner required 2 teeth to be identified and placed, and the intermediate required 4, and the advanced required 6 teeth to be placed within the same 5-minute time limit. The dental arch bases were created using modeling clay. Each contained 32 holes, which were divided into 4 quadrants to allow teeth to be inserted and held into the correct place. To begin, students were provided with a full set of 3D printed adult teeth, a dental arch base, and a full set of challenge cards. The students were then asked to select a difficulty level, and the stopwatch was started as soon as they were given a randomly chosen card from the selected difficulty level. The challenge was to correctly identify and position the teeth indicated in the correct orientation within the dental arch base. So the time will be started as soon as the student views the card. And here's an example of the gameplay using a beginner card with the teeth indicated as an upper right central incisor and the lower first molar. At the end of each attempt, time taken to completion is noted and the attempt is graded by a facilitator. 1 point is awarded for each of the following. So the selection of a correct tooth, insertion in the correct on the correct dental arch, insertion on the correct side, and finally insertion in the correct orientation. So a total of 4 marks are awarded per tooth. The game was available on 2 of the 6 benches in the lab, and the rest of the benches were used to carry out the traditional learning activities such as extract teeth and plastic models. In addition to timing and grading, each facilitator provided feedback and addressed any questions the students had. So here are our results. When asked whether the game added to their learning experience, an overwhelming 87% of the participants said yes. This confirms that integrating the 3D printed teeth and game-based challenges offered meaningful educational value beyond the standard curriculum. Next, we looked at whether this learning transferred to identifying features on extracted teeth. Again, a majority of the students, 88%, responded yes. So this points to the 3D printed models and interactive format, helping bridge the gap between theory and practice. We then asked a closely related question: was the knowledge gained through the game itself transferable to working with extracted teeth? And again, a vast majority of the participants said yes. We also wanted to ensure that the game was appropriately challenging. So 81% of students found the difficulty level accurately reflected on the challenging cards. This result highlights the value of involving students and co-creators in the design process, which ensures the challenges were well calibrated for the different learning stages. We then asked participants to rate the educational value of the teeth they used in their practical sessions, including both extracted and 3D printed teeth. They rated them from very poor to very good. Starting with extracted teeth, 45 respondents rated them very good or good. However, there was a small number of negative responses for extracted teeth. So 3 participants rated them either poor or very poor. While the 3D printed teeth had fewer very good ratings compared to extracted teeth, they received no negative responses in contrast to extracted teeth. This suggests that while extracted teeth held educational value, the reproducibility of 3D printed models may be redefining what reliable, accessible dental education can look like, especially as well-preserved natural teeth are increasingly more difficult to obtain, as explored earlier. Finally, we asked students which they preferred, extracted or 3D printed teeth. 88% actually preferred extracted teeth and 12% favored 3D printed teeth. While this may seem like a limitation, it's important to note that students still value working with real teeth. The 3D printed models enhanced learning and provided an inclusive educational model where natural specimens are now becoming more limited. This graph shows how the students engaged with the game over the 6-week period. In week 1, most students chose the beginner level with no attempts of advanced level, and as the weeks progressed, we saw a strong shift of beginner level play dropping while advanced level participation surged by week 6. So as seen here. This suggests growing confidence, engagement, and student motivation to challenge themselves, which was a key outcome of gamified learning. Of note, participation was limited by constraints like the availability of facilitators and lab time. Each facilitator needed time to obtain consent forms, explain the game instructions, and provide feedback. Additionally, students needed to complete other practical activities in the lab, which further limited their time available to attempt the game. Next, we looked at how long the students took to correctly complete challenges. While we initially expected time to decrease, we found it to not be the case. So in the beginner and intermediate levels, times fluctuated over the weeks. This could suggest that students initially completed tasks very quickly, but grew more cautious and focused on identifying the teeth more accurately. And finally, toward the end of the study, they gained enough confidence to work both quickly and accurately. Advanced times remained relatively high but consistent, indicating these were indeed challenging. Together, these results not only support the value of the game in developing confidence, familiarity, persistence, but also demonstrate that the game reinforced the importance of accurate practice, which is valuable mindset in the clinical setting. So, in conclusion, students improved their tooth identification skills over the course of the study, though it is still unclear whether it was through the implementation of the game or the other teaching methods that were employed. Students demonstrated increased confidence by tackling higher challenges as the study progressed. And while 3D printed teeth are highly rated, students still preferred extracted teeth. This may be due to the perception of authenticity or slight tactile or visual differences between the two. Knowledge acquired during the game was transferable to real-life teeth, and feedback suggests that the game is a good addition to stimulate engagement of some but not all the students, since only 53 of the 63 students invited completed at least one challenge. The study demonstrated the value of involving past students as co-creators, since their understanding of student learning ensured that the challenges were designed to the appropriate level. Ultimately, they transformed the project from an idea to an appealing game and ensured the sessions were engaging. So, based on our findings, the following are possible future directions for research and development. So, you could explore why the students preferred extracted teeth over 3D printed teeth. Was it due to personal bias, perception of authenticity, or other subtle sensory differences? Enhance fidelity of 3D printed models, refine the design and material properties of the 3D printed teeth to better replicate the look, feel, and variability of real teeth. So the impact of clinical performance study can be done to study whether students who engage with the game perform better in clinical setting over time compared to those who do not. So lastly, with thanks to the satellite grant provided by the Higher Education Authority of Ireland for this project was facilitated, and thanks to the Department of Anatomy and Neuroscience UCC for taking on this project. Thank you for listening. Bye-bye.